ABC7 presents Asian Influences. And now, here's ABC7's Linda Yu.
Welcome back to Asian Influences. Next, we turn the cameras toward a young and very driven doctor who, after noticing a startling number of Chicago's South Asians battling heart disease, decided to do something about it. ABC7's Ravi Baichwal introduces you to Dr. Shoaib Sitafuwala.
It's an epidemic. We're talking about Indians, Pakistanis, Bangladeshis have around a 4 times greater risk for heart disease. They have a mortality or increased risk of dying of heart disease that's about 50% greater at minimum than any other major ethnic minority or community within the United States.
It is a shocking statistic and one I know all too well. You see, I lost my father and my uncle to heart disease. Dr. Shoaib Sitafuwala is working to stem this epidemic and save lives. That mission is based here in Park Ridge at Advocate Lutheran's South Asian Cardiovascular Center. This clinic is the first of its kind in the United States. It began with the case of a Des Plaines man, 33-year-old Savio Matthew.
They took me to the hospital, and on the way they told me that I had a heart attack. So it was probably the most horrific thing for me ever.
This young father had a stent placed in his heart, and he has made major life changes with diet and exercise to hopefully prevent a second heart attack.
Hello, Savio. How are you? Good.
But Matthew's medical ordeal also happens to be the very inspiration for Dr. Sitafuwala's specialized clinic.
This is the 3rd Indian man in his upper 20s, lower 30s that we've treated in the last year. So I approached Advocate Lutheran General Hospital and I said that, look, we're a community hospital. South Asians are part of our community. We need to do something about this.
Much of the battle is simply about educating area South Asians about the elevated heart disease risks. Dr. Sitafuwala does this through events like Red Sari Evening, a takeoff of the famous Go Red campaign. He also does extensive outreach through churches and health fairs.
I found out that my cholesterol is high, my triglyceride is high, my HDL is high, everything is top of the chart.
Another key part of the care here at the center is early detection and prevention. Dr. Sitafuwala zeroes in on problem conditions with simple heart stress tests or even CT scans looking for possible blockages.
I find out that I have small pieces of blockage in my valves.
Sean did not require surgery, but like Savio, he manages his heart disease with medication, a healthy diet, and of course, regular exercise.
He said that if you're not going to do it, you're going to end up in a hospital and maybe you die. So that's the wake call that I needed.
Let's not wait for the heart attack to happen. Let's identify the risk factors, treat them with affordable medicine, and let's reduce your risk.
Reduce the risk, exactly what these 2 star patients of Dr. Sitafuwala have done.
There is no getting away from it, so better face it.
He's actually changed my life.
What the center tries to do is to create positive change. Don't let this scare you. Don't let this depress you. Use this as an opportunity to start anew and change your life.
If you would like more information about Advocate Lutheran's South Asian Cardiovascular Center, go to our website, that's abc7chicago.com, and find Asian Influences by clicking on ABC7 shows.